Glaucoma refers to an eye disease that has caused damage to your optic nerve, which is in the back part of the eye. The optic nerve is the connection between your brain and your eye, so the damage to it is permanent. It's usually due to a poorly functioning drain inside of your eye, which has led to an elevated eye pressure. This is one of the eye conditions that can cause blindness. We refer to it as the silent thief of sight, because it usually has no symptoms such as pain or blurriness until very late in the process. Glaucoma is divided into open angle, which is the most common type here in the US, and narrow angle, which is more common in certain other populations. Glaucoma, or damage to the optic nerve, is thought to be due to high eye pressure. During your visit, all of our testing is aimed at detecting even the earliest damage to your eyes. It may run in families, so knowing your family history is important. Some medications and other eye conditions such as inflammation or diabetes can also contribute to high eye pressure and glaucoma damage. Your eye pressure is unrelated to your blood pressure, although we are interested in hearing about medications you may be using for your blood pressure control. The treatment for glaucoma is usually aimed at lowering the eye pressure. I'm going to focus here on treatments for open-angle glaucoma, as this is the most common type we deal with here in the area. We consider this a way to apply the brakes to the process, not reversing any damage, but trying to halt it where it is. Glaucoma is a lifelong condition, so you need to understand that treatment is lifelong. Therefore, there are several options to help us in controlling your glaucoma. This can be achieved using eye drops, laser in the office, or surgery. Just like it sounds, eye drops are treatment you instill at home, and depending on the eye drop, it can be done once a day or up to several times daily. There are side effects associated with eye drops that we would go into during your visit. Laser is done in the office and is also aimed at lowering the eye pressure by getting absorbed by certain cells within the drain of the eye. It takes just a few minutes to perform the laser, although I usually tell people to expect to be at the office for about an hour that day for a variety of reasons. Laser can be done as a replacement for drops or in addition to drops, depending on the amount of pressure lowering that we need. Both eye drops and laser take some time to take effect, so follow-up is usually arranged about a month after either of those treatments is started. Of course, people always ask us about alternative treatments that they can do on their own, aside from medication or procedures. While we would always advocate for a healthy lifestyle and exercise, as these would lead to good blood flow to your optic nerves and your brain, these options would never really replace any treatment for glaucoma. Surgery for glaucoma can range from minimally invasive to more invasive options, and these conversations are usually tailored to the patient's needs and the amount of pressure lowering that is required. If you have any questions, please feel free to contact us here at the Medical Eye Center.